have a short small talk on clinical audits. I think, as Tani was saying, it has this audit, clinical audit, has given us all a fright when we first heard of it. Coming from Bangladesh, we have basically not heard of what clinical audit was. Um, and clinical audit is a very, very key feature in the NHS and its practice. It sounds scary, but it is actually quite simple and quite effective. There is a definition to it, clinical audit. It is a quality improvement process. What we do is to aim for a systemic review against a set criteria or set standard. We assess our own clinical practice comparing to a given criteria. Now, when we first joined NHS, I think the main struggle was what is clinical audit? How do I get involved as a part of clinical audit? The key again would be communicating with people around you, communicating with your consultants or your senior colleague registrars, even your trainee colleagues. There will be projects happening around. When choosing there are certain stages of clinical audit. The main stages would be selecting the topic of what we want to really see. We need to come up with a team, and then we have to go on agreeing to what standards or what are the clinical audit criteria and what are we looking to compare with. Going forwards, we do data collection, analyze the data, and get a feedback of our results. Now, that is the first stage of the audit. Now, as we were saying, it is a comparison with set standards. So when we have a set of data and we've analyzed it, we are doing to see whether we can make changes or implement changes that would improve our clinical practice. With our results, we find out what can be changed, and then we comprehensively decide what changes can be made. That is the first. That would be your first stage of your audit. You do a presentation, get a formal presentation done on it. Once implemented, once we have the audit implemented, the changes implemented, what we do is agree on standards, that agree on changes, and basically rerun the entire cycle. That is called a complete audit cycle. Now, coming to choosing a audit topic for our audit, it has to be a systemic process. It takes a lot of time and a lot of resources. So we choose a topic that will have potential benefit to our service. Now, there are possible sources for clinical audits. There's NICE guidelines and NSFs, other publications that we compare with. But when starting off in NHS, if you're looking for a first audit, it's just go up to your team leader. There will always be a clinical audit lead. Reach out to them. They will always have some topic of choice. Once you have a topic ready for yourself or your team, next would be who is your team. You select your team. It can be unidisciplinary, only within one specialty. Could be could be a set of your team members. It can also be multidisciplinary. For example, I as an acute medical team can collaborate with my pharmacy department, or I can collaborate with my microbiology department and come up with a project and implement. So that would be an example for multidisciplinary audit. Audit team, you will have to come up with a team leader. Often there will be a clinical audit lead in your department or your specialty, so you will have to speak out with them and your consultants as to who's to lead the project. You yourself can lead the project. but you will have to have a supervisor to guide you through. Then your topic ready. Next would be, what are we aiming? Setting our aim, objectives, and uh, we're looking to explore. What is the aim for project is basically considering what we want to achieve overall. What are we aiming to achieve? Um, a simple example of audit would be, let's say we are following this liver cirrhosis bundle. There is a criteria guideline from the Hepatic Society. Now, if we choose to compare, are we practicing the standards as compared to the cirrhosis bundle? So our objectives will be, how closely are we following those steps, and how closely are we following each and every steps when a patient is coming in. So aim would then be broken down to smaller objectives, where we're looking for, which further is broken down to um, uh, the objectives. Smaller, basically we are looking at different smaller aspects. Again, for cirrhosis bundle, are we doing the liver function test? Are we doing the encephalopathy scoring? So all those smaller details, are we doing it stepwise, are the standards that we compare. It's sorry about that. So as we were as we were
You were in
talking.
slide 8, yeah.
Yeah. So we were talking about selected. We've decided on the topic, and we've yeah. So we were talking about selecting the audit topic, and we've got an audit team, and now we've selected. We've decided on the aim, objectives, and the set standards that we're looking to explore. Yeah. So when choosing the when setting up our standards, we have to make sure we usually follow what we call a SMART protocol. It should be specific. It should be something that can be measured. We should all agree with what we are trying to look for, the objectives and standard. It should be relevant in terms of, it should help us improve our clinical practice, and it should all make a theoretical sense, basically. Ethics and management. For clinical audit projects, we usually do not need to submit the research ethical committee. It's more for research. However, if in case there's a topic where you only have ethical issues, you will have to speak to your clinical audit facilitator. Every hospital would have a facilitator, and you would need to seek their permission. Now, when you're starting the project, uh, you need to set a goal of how big your sample would be, or what your study size would be. It could be a simple snapshot of only, I mean, it can be as quick as 50 sample data, or it can be as big as 500 or 1,000, depending on what project you're looking to explore and what uh, criteria we are looking to exploring. Often at time, we do look for doing audits on very quick, because a lot of us just rotate 4 monthly through department, through different specialties. So we do not have a huge time frame to complete audits. So we would choose quick topics, but yet effective topics to complete with. Um, I have seen my colleagues doing topics as the compliance of antibiotic prescribing. So those are pretty quick. Even oxygen prescriptions, those are very quick uh, standards that we can look into. And again, it can be done within a week's frame. Planning and carrying out data collection. Once you have audit team, you have the audit lead, and you'll have to gather around a team, set of people who would help you do your data collection, including yourself. Um, Data collection. again, we're doing it as per the standards we set in. Um, it's a routinely recorded either from patients, we go on to patient notes or drug charts, whatever the standards, it's all in our system. So we'll have to make a chart that we can put the data on. Data can also be basically collected on a pro forma. Often we use our Excel as our common means to collect data and record data. Once data is collected, analysis of the data, I think a lot of us would starting off would struggle with analyzing a data. Um, Basic skills on Excel is, I would say, a key way of analyzing a data. Um, I have myself gone through several YouTube videos, basically learning about small, quick ways of analyzing a data. Once analyzed, we have as we started with the aims and objective. Our presenting findings, whatever the data we analyze, should be in accordance with the objective we had set forward. Um, it should address all the standards, and it should highlight the issues that come up in comparison to the standards. So those will be our key findings that we put through during our presentation. Once the analysis is done, again, we do a presentation, which is either done in a teaching setting. We present the data to our team. We basically distribute the data amongst the wider team. And it can even be presented um, as a poster if you've completed the audit cycle. Now, once you've had your data collected and analyzed, this is when we want to implement changes. This is the main aim of doing clinical audits, how we find out where we are lacking and implement changes to make our practice better. Um, as I was discussing the simple example of a cirrhosis bundle, um, while doing the audit, we'll probably compare with what the Hepatic Society has given set criterias. If at the end of the day, if we see that we are not really following the set pathways and standards, the changes that we might implement is to come up with a trust guideline itself or a trust pro forma to ensure for any patients coming in with liver cirrhosis, we follow those bundles. So that is the change that you are implementing. And you would do a re-audit to see if those changes are being implemented and has that improved your clinical practice. So I've made a very small presentation. I believe as I said, when I started off in NHS, my main issue was what is this clinical audit? It sounds scary, big, and something that I have no idea with. When you first join NHS, my suggestion would be um, speak to your colleagues. I mean, as I think everyone will reiterate this, there's always some project going around. Talking to people and getting into small roles of a clinical audit team is probably the stepping stone. Once you've been part of one audit, maybe in a small role as a data collector, you'll gain the confidence of leading a project yourself. Um, when it comes to applying for trainee posts, I think completing an audit cycle is more important than just being part of one audit cycle. If until and unless you've completed audit cycle, which means you've done one cycle of audit, you've found where you have your lackings, you've implemented changes, and re-audited to see if you've made improvement. That those two, until and unless you've done two cycles of audit, you're not completing an audit cycle. So for yourselves to score maximum for a single audit, you'll have to complete audit cycle. Um, um, on top of that, you will obviously have, I mean, being just part of audit team, and next going on to leading our audit would be a very uh, big stepping stone. Audits. Sorry, I've made a very small presentation. I've not included too much on it. Uh, I think there are lots of teachings going around. My trust has teachings on clinical audits, how to be part of it, and how to do clinical audits. If you go to different websites, including Royal College of Physicians, you'll see that there are teachings on clinical audits and quality improvement projects. Once you get involved in these projects, you will start thinking, you will get your own ideas. Your brain will start functioning and see that, okay, these changes you can implement. Reach out to your consultant. There's always a clinical audit lead. Speak to them, and if they're happy, if they give you the go ahead going on with an audit. You will have to get your audits registered to the board. There's a group within every trust. Um, uh, they govern the audits running in a hospital, so you will have to reach out to them, register your audit. And I mean, these audit uh, team or the clinical governance board, they will ensure that you're being pushed and finishing your audit in a given set of time.